nice to have you here for this 7th edition on generative AI for health. So we'll have a lot of discussion today. We're dealing with innovation, dealing with new technique, dealing with foundation models, dealing with clinical trials. But at some point, let's talk also about innovation in a way on how we encourage it. How do we finance it? How we reimburse it, maybe? The idea today is to have a look at how we support innovation in France in general, but also how we stay competitive in Europe and also in the world. So we'll have 3 axes of discussion today. Let's talk about the impact and evolution of Gen AI in healthcare. We'll talk about the implementation challenges also, and of course, the theme of our title, Explore Incentive-Based Financing Models for AI Adoption. So, as Ethan mentioned, we have a wonderful panel today with us. Thank you for joining us. It's really important to us and I think to our audience to have your POV. Maybe let's talk about the landscape, the evolution and impact that AI has in healthcare. I wanted to start with you, Nora, if you want. The idea, as a former minister and also former MEP, you have seen many evolution. You have worked also with institutions. You have seen the implementation of digital health in France. In a few words, how would you define this evolution?
Thank you, Sébatien. I would like to remind a story because the integration of digitalization of health has started in 2009. At this time, it was the first steps with some field of application, like the digitalization of the hospitals, the teleconsultation, and we took our time. We took our time because the shared medical file has started then, and we still haven't still achieved 100% of the French citizens having this shared medical report. The second example is the teleconsultation, which was in the law, but we took 8 years to define the fee of a teleconsultation, and it was done in 2019. So it became concrete 8 years after. We took our time, but considering the AI and the situation we are facing, we don't afford this time. We don't have this time because AI is a technology revolution, as you know, and it's really a tidal wave. It's a race against the clock because the competition is global. It's not a French issue, it's a global issue, and when we have a look on what is going on in the world, many countries have already implemented AI in their health system, and we have started to go on, but we have still some delays, some break, and I would say that the innovators go much faster as the public decision. And this is the gap between the innovators and the decision-making with the regulation, with the cost. And the issue about that is how we can keep our health system sustainable with an innovation which has a real great cost. So this is, for me, the issue that we have to face and resolve.
Interesting. And so we speak about innovation and how we accompany. Maybe Lise, as managing director of l'Agence de l'Innovation Santé, French Health Innovation Agency, with 3 ministries implied in this agency. How do you see the benefits of GenAI and AI in general, and what is your role to accompany this innovation?
Yeah, thank you very much for the invitation. As you just said, there is a huge potential of innovation, especially in the current context, to help transforming the healthcare system, especially regarding the efficiency and the sustainability of our system. To give you some examples of the innovation we are supporting currently, some of them are able to help physicians to anticipate each step of the patient pathway. Patient can be detected and diagnosed earlier. We are able also to provide them more personalized care and to anticipate the patient response. But also, this type of innovation are able to assist surgeons, for instance, to prepare and to perform their surgeries. To make sure the healthcare system is more accurate. So there is a huge potential, but I would say that the problem we are currently facing is really to make sure we can assess the impact of this innovation, especially regarding the efficiency and the impact on the organization of care. It's not only about the impact for one patient, the clinical impact, but it's also a populational impact we have to assess and to guarantee at the end of the day.
So we speak about impact, organization of care also, and we speak about innovation. And you mentioned, Liz, some use cases on GenAI. Speaking about use cases, maybe Alexandre, you want to talk a bit more about Kiro and also introduce like how this innovation can impact the health ecosystem, and from your POV, how does it include in this overwhelming innovation we have?
So thank you very much for the invitation. So what we do at Kiro is we do AI for clinical biology, so everything around lab testing. I think you're familiar with lab testing, so you basically end up with a PDF, or in France, A4 paper report. And at the end of the day, you end up with this cryptic information, a lot of data, actually. And so what we do at Kiro is really helping people better manage that information. And when I say people, it's first, of course, patients, to understand that information better and know a bit more about what to do, because we believe that if they get access to the information, then they can take care of themselves. But also physician, as is mentioned, which is also like about how can we be efficient, which test to prescribe and when, and so helping the system better. And so we manage about 150 to 200 patients every month, and we manage in total 3 million patients. And so basically, AI is helping in our field as follows. When you think about blood test, it's around like 30, 40 parameters. Blood testing is at the heart of healthcare. Like 70% of healthcare decisions are based on clinical biology data. So it's really at the heart of the system. And yet, it's 30, 40 parameters that all varies depending on the patient itself, the age, the sex of the patient, but also the history of the patient, depending also of other parameters. And that's very complex for the human brain to take all that information at the same time. And so basically what we believe is that AI can help structure that information and I mean, augment kind of the physician to use that information better, to help the patients better prescribe and like manage the system better.
Interesting. And so, Marguerite, in what has been said, because in France we have like a way to work, a kind of particular compared to other countries with the French Health National Health Fund. In your point of view, how do you help innovators? How do you follow up startups to help them like get financing, reimbursement? What are the processes and what are your POV on that?
Okay, thank you. So as you said, in the field of healthcare, AI is going to change the game. So we know that. And it's going to make preventive, predictive, precise and high quality medicine a tangible reality. So what you need to understand is that in France, we have two frameworks. One for devices for patients and another one for devices for professionals. So for patients, actually, we have like a process which is a very rigorous and strict process with an independent scientific evaluation. And at the end, the social security system is reimbursing, everything that is positively evaluated. So for AA devices, for example, you have currently the social security system is reimbursing insulin pumps with AI, and so it's existing. But what you need for patients is to have collected a lot of data. So the challenge for the AA tools for patients is to collect data, but the process is quite rigorous. The AI tools designed for professionals, you need to understand that the social security do not interfere directly. It's a B2B market. So when you develop an AI device for a doctor, for a hospital, and the social security, we do not pay. Actually, it's a B2B market, so the industrial is going to sell its products to hospitals, to doctors, and it's their decision. And we, at the end, we will pay like envelopes for hospitals, for doctors, but we do not interfere in the evaluation or in the financing. So we will see after that what are the consequences of those two frameworks, but it's for you to better understand the landscape.
I think that we understand better the landscape in general. So as I understood, there are challenges to help implementation of this innovation in France, to balance innovation, regulation, the frameworks that we have, one clear for patient and the other one for healthcare professionals. Speaking about implementation in general, Marguerite told about the fact that we need a lot of data, for example. That's a fact, and you will hear it all day long that we need data in quantity and in quality. Alexandre, maybe what would be like your technical challenges as an innovator, as a startup? Because we need data, we need interoperability also. What are the challenges that you face in this regard in France that could maybe affect or depend on the competitiveness also?
So we face actually 4 kind of challenges. The first one is the financing challenges, which is like how to finance innovation and how to make it like more powerful at a global system and at a local system. That's the first one. The second one is the interoperability issue. Like how can you make sure that the problem of France, but in Europe also, and I would say it's true globally, like you have a information system that are dated from the 90s. And you're working with AI, which is basically like the technology of the 2050. And so you need to bridge the gap between like what's in 2024, right? So that's the complexity with interoperability. Then you have a third problem, which is around who does what. Like you have bigger and bigger corporation that earns more and more money, and like AI for them is strategic. It's not their job. We know for the startups here around the table that how difficult it is to recruit, retain, and train data scientists, for instance. So it's a full-time job basically, and so who does what is very important. And fourth, which is the generative AI, which is like a tremendous the new technology, which is going very fast and that you need to apprehend every day. On the financing part, which is the theme of the conference today. I think that what's the CNAM is doing today is very interesting, because in some field you have actually so the way it works in a lot of fields, like the CNAM is reimbursing acts. So basically, like you have like you do something, and so you get refunded for that thing, right, for the act. In some specificity, and tell me if I'm wrong, like you're also reimbursing, like you're dividing the act in 2 things: the innovation or the technical forfeit, and the clinical forfeit. So you're basically saying, okay, like there is, for doing this act, I need an innovation, I need a technology. But I also need the power or the intelligence of a clinician to use that technology. And I think that this kind of system is very key, in my opinion, and it's in too few sectors, basically, because like in biology, for instance, you're reimbursing a glycemia, for instance, or a glucose level, or a creatinine, and not what you do with that. But I think that's, in my opinion, the key for the system in how to finance that. And that's quite unique, actually. And the reality is that this is probably how you can incentivize people in investing in innovation, but also making sure and differentiate basically between the good physician and the bad physician in how they use AI and how they get more efficient with their clinical practice and the information they can deliver to the patient at the end.
Maybe a reaction, yeah.
Yes, that's true. As I said, it's a B2B market. So it's a B2B market, so you need to have buyers, doctors and hospitals and physicians. And when they buy devices, they can buy devices because it's more efficient. They will make their work easier. So in this case, they are willing to buy. And the other one is to make more qualitative work. And for the second one, is the system incentivized enough to buy AI innovation to be more qualitative? It's not so sure. So what we need to improve is in a B2B market without public interference, we want to see how the market is naturally absorbing innovation, and what we see is that when it's innovation based on improving the quality of the diagnosis, the quality of the health system, the absorption is not natural, and so we need health authorities to rethink the financing innovation tools. So that's key, because when you are a physician, why would you buy something very expensive so you have a 10% chance to have a better result? Who is paying for a better result?
And so, Liz, what's your role? Because I think that you can have a role to help both CNAM and innovators like Alexandre to, like it was maybe the goal of AIS. What's your opinion on that?
So perhaps just for you to know, we have opened a one-stop shop at the Health Innovation Agency a few months ago. Every innovator can apply and benefit from a 1-hour meeting support program. So we are able to orientate innovators to public funding, but also to private investors or regulatory authorities. So this is just for the supporting program we have put in place. We have already met more than 400 project leaders for 1 year, and I think this one-stop shop is really key to make sure innovators are aware of the system in France. As Marguerite said, some of them are not, so it's important to make sure they can anticipate each step of the pathway, first of all. And then regarding the problem we are facing regarding the business model for innovators, it's really, I would say, egg and chicken paradox, because in fact, for innovators to make sure they can prove and demonstrate their value, they have to be sure they can be deployed at a large-scale level. But to be deployed or to be sure that they can be on the market, they have to demonstrate their value. So this is the timing is really critical, but I think, and with the National Health Insurance, we are currently working on this type of program or experimentation to make sure we can move forward and propose some solution to find and to help define the business model if needed, because as Marguerite said, in some cases it's not necessary, because the physicians and the healthcare system will find the way to buy this type of solution, because it's clearly efficient, and there is no need for the public system to interfere in the game.
Interesting. We said about the fact that we have to wait to have the process, that we need to define who needs to have a process or not. Maybe Nora, quickly in your POV about France as a country in a marginalized world with competitors in all the ways. How do you see quickly the need to be also fast in innovation, but also fast in regulation? What's your POV on that, and how do you work as a former minister in this POV on that, like the evolution?
The challenge is at 3 levels. It's the regulation, the acceptability. Regulation, the acceptability for healthcare professionals and the patients, and of course the financing. So if we resolve these 3 issues, then we will be the best. But if we take a look at the landscape, in terms of regulation, yes, we have improved the landscape. Yeah, we have now the creation of the AIS with Lisa Alter as the director. We have now the delegation to the digital health, which is very, very efficacious. But maybe we should more bring together all the stakeholders around this public decision and the structure of the public policy on digital and AI, because we have regulation, but not specifically focused on AI. And maybe we have to move forward with a regulation dedicated for that. So at the European level, there's an ongoing regulation, which is AI Act, which will be, of course, implemented in all the European Union countries. If we compare, for example, to the US, they have an executive order, which is the president decision, but we can see that the 2 regulations are quite the same, but in our case, it's approved by the parliament, the members of the parliament, but in the US, it's a decision of the president. So we don't know if, for example, the American president, the current president, will keep this act effective. The second is the acceptability of the patients. They use the AI, so it's appropriated by the patient. So it's not the real difficulty. I would say another word on the training, because AI is improving the system, improving the management of the patient, the hospital management, but we have to integrate the training into the training of the healthcare professionals, and of course the financing. Today, the most finance is public finance, and we have to improve, the integrated financing, maybe through public-private consortium, maybe to identify some strategic pathway to keep a leadership and to preserve a sovereignty of the country. But I would say that will be more efficient at the European level than at French level.
So I think like the transition is really clear. We talk about we have to have the financing evolve. So we have a few minutes left, but maybe Marguerite, what's your opinion? Like, how would we evolve as an incentive-based financing models? What are like the collaboration we can have? And the question is, how do we stay competitive thanks to this?
Maybe 2 things. The first thing is that in some fields, we know innovation is not going to be adopted by the market. For general practitioners, for example, they do not buy innovation. So we are launching experiments, and one especially for general practitioners with an AI tool to diagnose cardiovascular pathology. So it's a first step. And after, we need to look at some fields like biology, radiology, which are fields that historically have absorb innovation, they buy innovation, but we are not sure they will be incentivized enough to buy innovation providing qualitative results for patients and for the healthcare system. So to me, it's an approach, a vertical after vertical. So we need to look at biology, we need to look at radiology, we need to look at ophthalmology. So we have some verticals we need to consider, and it's a work we're doing with Lisa, and it's quite difficult because it's specific for each field, and I think at the end we will have some what you say, like some financing specific for AI tools, and some yes, we will say, okay, if you buy this kind of tool, you have as a practitioner, you have a more payment or more financing incentives.
Perhaps just one word, because we have just launched a new call for project in the context of France 2030 based on innovation and prevention. This is quite interesting because it's not I would say, the solution for everything, but the objective is really to help innovators based on public-private partnerships at a local level to implement their solution. Some of them will be based on AI, and to help them demonstrate the value of their solution in terms of efficiency, organization of care, populational evidence, clinical evidence, of course. So the objective at the end of the day is really to help move forward and be able to identify the impact of this type of solution on a large-scale level, and then to provide evidence, perhaps to discuss about funding evolution and assessment evolution in the field of AI and prevention. So this strategy is funded through 100 million euros, so it's quite a huge amount, and it will be, I think it will help move forward with this political evolution and funding evolution of the system.
I think we're running out of time, but maybe before ending, maybe if you have, like, in one sentence, Nora and Alexandre, a message that you want to have the audience hear in one sentence, maybe to close this session.
Yeah, I would just raise that there's a gap between territories, between patients. So we have to take the opportunity of AI to fill the gaps and fight against inequalities. I think it's an opportunity, and we have to take it plenty, yeah, and think about, the European level to solve all the issues that you are facing.
And Alexandre.
So I think when we talk about financing as a startup, my advice is, like, not just to wait and see what the CNAM is going to do or what the state is going to do, because otherwise, like, you're probably dead before, like, something happens, to be honest with you. But then still, and that's super important, like, we saw the landscapes change over the past years. Like, when I started Kiro, it was like you were discussing with IRS, you were discussing with the GGOS, the GGS, you were discussing with the ministries, you were discussing with the CNAM, you were having discussion with the HIS and so on. And so it was, like, honestly, like, a very complex system. We are now part of the French Tech 2030, so which is like a government program. And so we saw also the help of the IS in, like, helping us navigate around those things and really understanding how all these people work together to increase the value for the patient at the end of the day. And so that's also super important when you talk about exploring incentive-based financing, to understand also your ecosystem. So who is paying what for what? How is technology evaluated? How does it work? And why it takes time also. And so that's also very helpful to better understand your role as a startup, how you can innovate in that sector, and how you can make it happen, basically.
Thanks a lot to our wonderful speakers. I think we can have a huge round of applause. Thank you very much.
And maybe the entrance barrier,
Yeah.
it's high. But after, when you enter the market, you have all the market.
I think it's a good Hobbes message at the end. Thank you very much, Marguerite. Thank you, everyone.